this is Debbie Grape, so we're going to go ahead and get some blood for a few different things. I'm just going to kind of do everything at once because Max here needs some blood run. So first of all, we're going to do our plasma and serum. So for that, I need these 3 tubes. I have a Tiger Top tube. This one has a separating serum in it. I have just a regular light heparin green tube and then a plain red top tube. Okay. Then we're going to do an in-house blood panel that we're also going to send off. And so once again, I need a green top tube with light heparin, and I also need an EDTA tube. Okay. So I'm going to put my needle on a large syringe here because I need lots of blood for this. Alright, you gonna cooperate, buddy? Okay, so Max wasn't cooperating like I hoped he would, so I've got Allison here and she's gonna help me hold him. Okay. You're being a good boy. I'm gonna get this whole syringe full. Buddy, We're almost there. Good boy. And so I'm gonna hold off and then I'm gonna let Allison finish holding off for me.
Good job.
So the first 2 tubes I need to put blood in are my EDTA tube. I need to rock it at least 4 to 8 inversions. And then also my light heparin tube, because these 2 tubes, we don't need them to clot. That's why we're putting them with anticoagulant. Okay. These other 2 tubes are fine to clot because they're going to have to be spun down anyways. Okay. All right. Okay, so we're going to do an in-house CBC and electrolytes. So I've got my purple top and my green top tubes here. So we use Abaxis. This is the VETT scanned tube. And so I'm going to use a pre-anesthetic rotor here. So this is the chemistry, and so for the chemistry we use the green top. And I'm just going to get one of these pipettes. I'm going to take off the lid, push down the top of the pipette and pull up a full thing of blood. What I'm going to do here is I'm going to push blood into this little hole very slowly and let it fill. Okay. I know it's probably hard to see, but there's a little arrow right here showing me where the blood needs to go, so I don't have quite enough. So I'm just going to get a little bit more. Okay. Almost there. Okay, so that's all I need. So what I'm going to do is I literally just place this in the chemistry machine and hit close. It starts to run it immediately. Alright. So on here I'm going to select dog. I'm going to put in his patient number. And that's all I have to do for the chemistry. Now, for the CBC, I'm going to hit patient ID here, put in the patient ID number, He has a dog, Dr. Tucker. His name is Max Spears. He is 7 months old. And he is now a neutered male. So I'm going to invert this tube just a little bit. And there is a little space right here where I'm going to take the cap off and set it here. And I'm just going to hit accept and start. And that automatically starts my CBC panel. Okay, so our in-house blood panels have come back. This is our CBC. And this is our chemistry. And I've already spoken with the doctor about everything, and everything looks pretty normal, except for we do have some high eosinophils and some high white blood cells. So we probably have an infection somewhere, and we also probably have some worms, so we need to do a fecal. So all I'm going to do now is record these results in the computer. So I'm going to go to Max's account here. And what I do is I record all the abnormalities. Okay, and that's about it. That's all we need to put in. And so we'll just have to discuss with Max's owner when she gets here what we found. Actually, I'll probably give her a call here in a minute, and then we're gonna send this off now. Okay, so we're going to send Max's blood work off to the lab, and so we send to Antec. I have a form here that I'm gonna fill out really quick. I have Max's chart here so that I can use all the information. So they need his chart number, doctor name, the date, client is Spears, pet name is Max, he is a canine, he is a golden doodle, he is a castrated male, and he is 7 months of age. So I've got all my information here. And so now, let's see what we need here. Where is it? Okay, so what we're going to do is we're going to send off for a CBC with differential. So I'm going to just mark this box. And then I'm going to get a highlighter and highlight the one we want, and that way it's easy for the lab to see. Okay, so next I'm just going to tear off these strips of paper on the side. So this top sheet goes to the laboratory, this sheet is our copy. So I'm going to come over here where I have all my supplies ready. If I can get it set up correctly. So I'm going to fold this piece of paper. I'm going to put it into an Antec baggie. And get my purple top and my green top, and I'm going to roll them in paper towel just in case they decide they want to spill out. And I'm going to put them in the baggie with the form. We have an intake box here. I'm going to put an ice pack in here because our blood has to stay cold, along with the blood in the form. And last but not least, we're going to use a FedEx clinical pack, and we're going to put the box in the pack. Okay. And so all I have left to do is I need to put a label on the package and call FedEx to come pick up, and it'll be good to go.